Today's topic involves people who don't have a thyroid. Although some people may have been born without a thyroid, most persons who don't have a thyroid is because they had surgery. Thyroidectomy refers to the surgical removal of a person's thyroid, while hemithyroidectomy or partial thyroidectomy refers to just half or part of the thyroid gland being removed. It's interesting to note that more than 150,000 thyroidectomies are performed each year in the United States. The main reasons are for thyroid cancer or hyperthyroidism, either Graves' disease or toxic nodules, or goiters that are causing issues like pressing on the windpipe or on the esophagus. So, after thyroid removal, in best case scenario, what's the medical advice that I give my patients? It's important to remember if you've had your thyroid removed, you need to take thyroid hormone replacement. Whether it's levothyroxine, which is T4, plus or minus liothyronine, which is T3. These are synthetic formulations, or a natural form like desiccated thyroid extract. We essentially have to recreate with a medicine what your thyroid would ideally do on a minute-to-minute basis on its own. It is not a one-size-fits-all. It may take a little time to find the right form, the right dose, the right combination, and a little patience may be required. And you need to try and be consistent. Take your thyroid med around the same time every day. Take it on an empty stomach by itself. After a partial thyroidectomy, do patients sometimes need thyroid hormone replacement? Yes. Up to 25% of persons who have had a partial thyroidectomy, or just even half of their thyroid taken out, may still need thyroid hormone replacement. And remember, the entire thyroid is taken out, then the patient will 100% be guaranteed to have an underactive thyroid level from that point on. They'll have to be on thyroid hormone replacement for the rest of their lives. And that's one of the several things I'll continue monitoring for on my end. So when patients are on multiple medications, perhaps for other conditions, they need to avoid taking those other medicines at the same time as their thyroid medication, because taking them together can affect the absorption of the thyroid medication. Even supplements can interfere. Even your coffee with creamer can interfere. So for example, if you're taking an iron or calcium supplement, they should be taken far apart from your thyroid medication. Can we talk a minute about why the thyroid gland and proper thyroid levels are so critical to human health and life? This is going to help us understand why removal of this gland is a serious act. The thyroid gland is crucial for making thyroid hormones. Remember, thyroid hormones control metabolism. Every system in our body is affected by thyroid hormone. Removal of the thyroid is a big deal because our thyroid affects how we exist on a daily basis, how we feel, how we think, and more. I don't personally do surgery, but I provide care for my patients after surgery. So that's like monitoring, prescribing medications, ultrasounds when needed, and so on. How does a thyroidectomy impact the rest of a person's life post-surgery? What are some of the profound and also some subtle differences from pre-surgery to post-surgery? I get these questions all the time. Well, remember, we're trying to recreate with thyroid hormone replacement what a gland did for itself. Many people do quite well with levothyroxine, which is T4, but up to 20% of the population does not convert T4 to T3 very well, and they will not feel well if they don't have some sort of combination therapy of T4 and T3. It's so important to communicate with your doctor how you're feeling. Keep a log, follow up regularly, get your labs done regularly, and take your thyroid medication regularly, consistently on empty stomach. A question that I get often is, well, can we assume that in some cases, if the thyroid wasn't already working well before surgery, the difference may be significantly improved after surgery, with just some or a little more thyroid hormone replacement? Not necessarily. Say, for example, someone has Hashimoto thyroiditis and they were on a small amount of thyroid hormone replacement. Now they don't have a thyroid at all. The dose needs to be much higher. You're more reliant on thyroid hormone. I could prescribe the more expensive thyroid med out there. If they don't do all the things we talk about on the podcast regularly in regards to Hashimoto thyroiditis, like maintaining gut health, working on stress management, ensuring good nutrition, and so on, they will still not likely feel their best. So thyroidectomy is not a quick fix. Thanks for listening, and that's your Thyroid Talk tip for the day. Don't forget to check out the Thyroid Talk podcast, and please subscribe to the YouTube channel.